It was a funny way to stumble upon it, honestly. So my mom was in the nursing sector, so more on the clinical side of healthcare. And then my dad was more on the business side. So he had an MBA and did a lot more of the operational things. And I kind of picked up a niche from both sides. So then I was like, is there anything that kind of intersects the two where we can be in healthcare but not specifically do clinical work? And that's where I came across this health informatics and health information management program. And I met with the counselors and it seemed like a really good fit. I think a lot of people assume when you're in healthcare, oh, it's always clinical. But there's so many other jobs out there that are not clinical and are much more complex and operational. So it's really interesting to see how it all intersects and works together. I think the best thing about the faculty is that they're actual working professionals within the field itself. So they don't just bring the curriculum that's provided, but it's also the real world tools and technology and understanding of this everyday changing sector that we're in of healthcare informatics and health information management that they bring to their students. So you really do get today's world learning of the health informatics program. When I looked at the curriculum, that's really what got me. So the curriculum is really diverse. I think if there's every little thing you can learn about healthcare informatics, it's within that curriculum. There's, job research help, where there's a course where you're doing a capstone, a real life capstone, which is really common, but sometimes it's like fake projects, right? But these are like real life problems that we're solving within our capstone. And the curriculum itself is very diverse. There were so many different classes. No two classes are alike, and they all kind of build upon each other. So it really made me feel like I could probably get any job within the health informatics, health information management sector. So that's really what drew me to the program, is the variety of the classes that they give. And it's kind of like a holistic approach to health informatics. So when you do get this degree, you can really do so much with it. It's not like a one-line path, right? There's so many paths you can take with this degree, which is really cool. I felt really comfortable actually entering the workforce. I did my RHIA credential, and that kind of got a lot of guidance from our professors as well. So I felt really confident kind of entering the job force. So I started off as a patient care coordinator at Swedish Medical Group, really understanding kind of the front end work, registration, insurance, claims, appointments, scheduling, kind of how all of that works, and getting my first inside look into Epic, which has been really neat. From there, I kind of took a pivot into the tech sector and applied more analytical interest. So I was working on a fitness app at Amazon, which was really neat. It was kind of healthcare related, but not very much like clinical focused, right? So I really got a niche for analytical skills there. And so then I thought maybe I should learn a little bit more about this. And so I decided to pursue my master's in business analytics. And that kind of stumbled me upon this role at Fred Hutch, which is a mix of being a business analyst and a project manager. And I was like, that's pretty neat. That's kind of something new. And clinical trials was something I wasn't very familiar with. And then most recently, I joined here at UW Medicine. Coming full circle, I've always wanted to work at UW Medicine. But I joined here as a senior business analyst in the PMO. So it's within the project management office, within IT services, and I'm a senior business analyst here, working on KPIs and SLAs. So it's a little bit more specialized, but that specialization really came from what I started at Fred Hutch. And so what's really neat is I learned a little bit everything kind of as I went from one job to another, and picked up off of kind of, okay, this is more interesting, and leaning in towards really what I'm good at. And you just naturally kind of find, what your passion is, and it kind of leads you really. So that's where I am today, and I'm finishing up my master's in business analytics. So I feel like I finally found my path, but it's forever changing. But one thing that's consistent is healthcare is where I've always wanted to be. And numbers are my thing, so it works out really well.